Healthcare providers' understanding of their patients' healthcare beliefs, values, and preferences is an important feature of patient-centered care. There are several reasons why this understanding is essential. First, a key supported principle about health behavior systems is that a patient's beliefs about health, for example, cause of disease, controllability of an illness, value of different treatments, and it predicts health behaviors such as medication adherence, use of healthcare services. Second, healthcare providers' skill at perceiving and understanding patients' belief is also an important aspect of compassion. It equates to perceptions of higher quality care and more effective communication. Lastly, the patient satisfaction, commitment to treatment, and perceived outcomes of care are greater when the healthcare provider and patient achieve a shared understanding on issues. The patient has the right in decision making, the meaning of diagnostic information, and the treatment plan. It also helps improve access to high quality healthcare that is respectful of and responsive to the needs of diverse patients. Healthcare providers often have a modest understanding of their patients' beliefs with respect to patients' preferences for involvement in making decisions. Once recognized, they can be modified or incorporated into joint approaches to treatment. Learning patients' belief is an important early step in developing the nurse-patient relationship. When patients and healthcare providers listen and communicate with each other, they are likely to develop a shared understanding that may improve future decision making and quality of patient care. Patients' beliefs determine their responses to an illness and the strategies that used for coping with it. Beliefs can be explored fairly simply by careful listening and a few directed questions. These beliefs are, of course, culturally determined and all come together to form a larger health belief system. Why is it important to understand the beliefs of the patient? Acquiring a better awareness of a patient's health beliefs may help healthcare providers identify gaps between their own and the patient's understanding of his or her health situation. Consequently, this may lead to treatment choices more acceptable to the patient's expectations and needs. How can personal beliefs affect the care of patients? Patients' personal beliefs may lead them to ask for a procedure for mainly religious, cultural, or social reasons. They may refuse treatment that you judge to be of overall benefit to them. What beliefs are important to nurses? Core values of nursing include altruism, autonomy, human dignity, integrity, honesty, and social justice. The core ethical values are generally shared within the global community, and they are a reflection of the human and spiritual approach to the nursing profession. Health beliefs are what people believe about their health, what they think constitutes their health, what they consider the cause of their illness, and ways to overcome an illness. Beliefs are, of course, culturally determined and all come together to form larger health belief systems. Different cultures have different definitions of what constitutes health and what causes illness. Culture itself can be defined many ways, but it is basically the characteristics that comprise a group of people's ways of life, such as attitudes, beliefs, and practices. Our thoughts and emotions follow our beliefs and create the attitudes, assumptions, expectations, and behaviors that determine how we react to life events and what we think is possible. These underlying belief systems drive our behavior. Similarly, health beliefs influence health behaviors and health outcomes. In assessing a patient's condition and taking a history, you should take account of spiritual, religious, social, and cultural factors as well as their clinical history and symptoms. It may therefore be appropriate to ask a patient about their personal beliefs. However, you must not put pressure on the patients to discuss or justify their beliefs or the absence of them. Both health professionals and patients are influenced by their respective cultures. Health system has been shaped by the mainstream beliefs of historically dominant cultures. Cultural bias may result in very different health-related preferences and perceptions. Being aware of and negotiating such as differences are skills known as cultural competence. This perspective allows care providers to ask about various beliefs or sources of care specifically and to incorporate new awareness into diagnosis and treatment planning. Demonstrating awareness of a patient's culture can promote trust, better healthcare, lead to higher rates of acceptance of diagnosis, and improve treatment adherence. Healthcare providers are more likely to have positive interactions with patients and provide better care if they understand what distinguishes their patients' cultural values, beliefs, and practices. However, healthcare providers should learn skills around diverse culture, values, and belief of a patient. Such skills can be a compass for exploring, respecting, and using cultural similarities and differences to improve quality of care and patient outcomes. Above all, remember that cultural beliefs are dynamic. There is a huge diversity within any culture, and even when you think you understand one culture, it will have evolved or you will have identified exceptions.